We're going to cover a lot tonight. I'm going to try to keep it as clear and concise as possible while still giving you all the information that I feel that you need to make the best decisions about your health throughout perimenopause, menopause, and beyond. And it is come to my attention even more so over the past year how confusing this time is and how hard it is to kind of decipher from what one doctor is saying to the other, from what you hear on TikTok versus what you hear on YouTube versus what you hear amongst your friends. It is insane. And I can't tell you, I travel a lot, and no matter where I go, as soon as someone finds out what I do, I am swarmed with questions, even from women who are under the care of a doctor and they are on hormone replacement. They still have no answers to their questions and why they're still having symptoms, and it's really insane. So tonight I hope to clear some of that up, give you guys some resources, make it easier to go through this tumultuous time in our lives. So I do have some slides I'm going to share, and I'll turn those on in just a minute. We're about the top of the hour. It looks like we still have plenty of room in the Zoom room, so I don't think we're going to get to capacity, even though we had many people sign up. But I hear that electricity is going out in certain areas, so we are all good to go. And hi on YouTube. Good to see you. Hi from Arizona. I'm going to get into questions and protocol questions and questions about products towards the end, but I'm going to try to keep it kind of clear and concise. I will ask you guys some questions or some feedback along the way. All right, you guys ready to get started? We're at the top of the hour right now. So I'm gonna go ahead and share some slides. So let me do that. So you should be able to see my slides. And I'll put myself down at the bottom. If it becomes cumbersome or I'm covering up some of the slides, then we will go ahead and take me off the screen. But I want to be as engaging as possible as well. So what are we talking about tonight? We are talking about what every woman needs to know about hormone replacement and perimenopause and menopause, but her doctor isn't telling her. Why is her doctor not telling her? It's not because he's mean and he wants to keep a secret. It's because nobody told him or her in medical school. Doctors get plenty of education about postpartum, about pregnancy, about keeping a baby, but that's like women's health. It's reproduction. Reproductive health is women's health. Once you get to the stage where you're no longer making eggs, you're no longer fertile, there's like no training. It is just treat the symptoms with a medication. And so it is really confusing, and it is absolutely insane. So we're going to talk about why that is, and one of the main reasons is because our modern medical system is actually set up to manage disease. So their tools in their toolbox are surgery, testing, and medications. And so when you go in to the doctor's office with joint pain and hair loss and depression and dry skin, dry eyes, dry mouth, and digestive issues, and all the things, your doctor is like, okay, I need to treat all those individual things. You might leave with a list of referrals to a cardiologist and a rheumatologist and a skin doctor, because these doctors are brilliant for emergencies like heart attacks, car accidents, major infections. But when it comes to hormones, metabolism, mood, sleep issues, chronic health issues that are the outward manifestation of inward dysfunction, they are stuck in the pill for an ill model where you're just medicated and you're not truly healed. And so when you go in with your hot flashes, your weight gain, your insomnia, or low libido, what do you get? Well, you're going to get antidepressant for any mood issues. You're going to get a sleeping pill for insomnia. You're going to get a statin for cholesterol, which I will tell you, statins have not ever been proven to work on women at all. And one of the main indicators of low estrogen or estrogen decline is increasing cholesterol. So a lot of people don't put those things together, and most doctors don't put that together. And instead of going after that high cholesterol with some estrogen, which is going to be anti-inflammatory and lower your cholesterol, they give you a statin, which works in men but not in women. And so that is a problem. And then your cycle, when your cycle is off or you're not cycling regularly, they try to regulate your cycle with birth control, which absolutely does the opposite of regulate your cycle because it gives you no cycle at all. So anyways, I will get off my soapbox, but it is really unfortunate that this is just 4 of the issues. There are 99 different symptoms of perimenopause and menopause. And could you imagine walking out of that doctor's office with 99 different pills? That would be insane. And they could just do one thing, and that is replace your hormones. And it used to be that they did. So the question on everybody's mind is, will hormone replacement therapy actually help me, or will it hurt me? Because I've heard a lot of bad things about this hormone replacement therapy. I've heard it causes cancer. I heard hormones are dangerous. I heard hormones are only for women who are just hit menopause at 51, but once you're 60, 70, 80, you can no longer take it. You miss the window. I've heard if I have a family history of breast cancer, if my great aunt had breast cancer, I can't have hormones, or if I've had breast cancer, I can't have hormones. And that menopause and perimenopause is just a normal part of aging, and we should just deal with it. We should just suck it up, put our big girl panties on, have a glass of wine, and just deal with it. Well, that's the opposite of what we should do. We actually really should understand that none of this is true. Absolutely none of it. It's all been proven. Study after study after study for the last 20 years, there have been many, many studies have proven that all these are false. And you'll learn in just a little bit that it's the time without the hormones, it's the lack of hormones that is the most dangerous thing you can have. And so I'm going to get into all of that today, but I just want to make sure that hits home. All these sayings, all these warnings, all these lies are basically fear-based and very outdated. And so by the time we're done today, you're going to understand that hormone decline is dangerous, and well-done hormone replacement is life-giving. It's going to make you feel better and actually help you live longer, stronger, and more resilient. But it's not, all hormones are not created equal. We're going to be talking about how properly managed bioidentical toxin-free hormones will not just make you feel better, but protect your heart, your brains, your metabolism, your skin, and your long-term health. So grab some water, silence your phone, grab a notebook, shut the door, and we are going to talk about all of this that is going to change the next 10, 20, 30, 40 years of your life. Let's go. But before we do, just want to introduce myself real quick. Those of you who may or may not know me, I am a licensed naturopathic physician. That means that I learned all the things that most doctors learn. We learn pharmacology and all the systems of the body, but we also use how to use nature and lifestyle as medicine. I am board certified in anti-aging medicine. I'm a menopause and hormone specialist. I've been featured on many, many publications and news stations and in documentaries as one of the top menopause doctors in the country. I've helped thousands of women restore their hormones every year. And I am the founder of Glow Natural Wellness and the creator of Clean Hormones, which are 100% plant-based, toxin-free, cruelty-free, bioidentical hormones. So they have all the good stuff, none of the bad stuff. And I really believe in research and science, and I believe in separating fear from science. And I think that that is what has been really hurting women for the past 20, 30 years, is all the fear and the lack of a science. So we're going to get into all that today. Personally, I am doing this. Why am I so excited about hormones? Why do I feel it's such a duty? Because I lived through it myself, basically. So as a child, my mom, God bless her, did not know anything about nutrition or health, and we always ate processed food. I was sick a lot. I was put on antibiotics pretty much every month. As soon as there was a sniffle or a cough, my mom would call her friend who was a doctor, we'd get antibiotics, we'd get better quicker. So she was happy, we were happy. But I had a lot of low confidence. I was a chubby little kid. And then by age 12, I had the most horrific periods. Like, they were heavy. I was in so much pain. I was just bowled over cramping. And I would miss school a few days out of every month. And so I went to the doctor. Doctor put me on birth control pills. My mom freaked out because she's an Italian from New York. And to have a 12-year-old girl on birth control pills was an absolute scandal. I was sworn to secrecy. And it made me feel like I was dirty or something bad about me because, it was like embarrassing for her that I was on this medication. So how do you think that made me feel as a 12-year-old girl? Well, not very good. By the time I got to high school, or actually junior high, so junior high and high school, I started running on the track team because I just wanted to feel somewhat control of my body. I wanted to lose some weight so the boys would look at me, but I was not a runner by nature. I went out for the track team. The coach was like super cool. She was like a hippie, very happy all the time. She had a garden, and that was opposite from my family, who was depressed and sad and negative all the time. So I really gravitated towards her. And she told me, Michelle, your body can do anything you want it to do. All you need to do is feed it, train it, and believe in it. And that to me was like, it really hit me. And I really believed her words. And it just gave me so much hope for what I can do, because my dad used to say, life sucks and then you die. And the whole mentality in my family was, everybody has pain, everybody has discomfort. We don't talk about our problems, just suck it up and do your best. And so when I had Coach Shay, who was like, Michelle, you can do anything you want. Your body is amazing, but you have to nourish it. You have to support it. And so she would bring me vegetables from the garden, and she would, encourage my running. And so I actually ended up getting a track scholarship to college, which I was the first person from either side of my family to go to college. So that was a big deal for me. And in college, I was on so many over-the-counter medications. It was insane. I would take 6 to 12 ibuprofen, like Advil, in the morning when I woke up, just so that I could go to my morning practice without having the joint pain, because my joints hurt so much. I would take things to help me go to the bathroom. I would take things to help me stop going to the bathroom. I would take Vivarin to kind of help me wake up, and a bunch of Diet Cokes and caffeine. And then I would take sleeping pills to go to sleep. I had Tums. I had all the different things you can imagine in my dorm room, and it was just overwhelming just so I could function. Then at age 20, I passed out on the track during practice. I was taken to the clinic on campus. Initially, they told me there was nothing wrong with me. I should just go home and drink water. They gave me an IV, sent me on my way. I broke down. I told them all about my joint pain, my hair loss, my cramps, all the things I was dealing with, my migraine headaches, my hot flashes, my difficulty sleeping, my difficulty waking up, the weight gain around my midsection, despite the fact that I was running track every day. And so they sent me for some blood work. The blood work came back. I was told that my ovaries had failed. So the diagnosis was primary ovarian failure. I was 20. I said, what does that even mean? And they said, well, basically you have the hormones of a 50-year-old woman. Your ovaries are no longer working, so you're kind of in menopause. And I was like, holy moly, that can't be right. So I was like, well, what do I do about it? How do I fix this? And they're like, well, there's nothing you can do. This is just what it is. Your ovaries have failed. It's failure. It's done. It's over. And so that really devastated me. I was so sad. I just felt so alone. I felt like my body was broken. I felt like I wasn't even like a woman anymore. Like, what was happening? I tried so hard. I was getting good grades in school. I was doing all the things. I was eating my vegetables. I was going to running track. I was doing everything I could. And yet here I had this failure. And it was really horrible. And I went to so many different doctors to try to get someone to tell me that there was something I can do. And they all told me, no, it's a final diagnosis. There's nothing you can do. And, it was sad because I got to see firsthand how poorly prepared our modern medical system is to treat the issues of hormone decline. They were great at when girls came in and they were pregnant, or they were dealing with postpartum, or they were going for their well checks during their pregnancy. They were welcomed with open arms and everything was so nice. But me, they just kind of tossed to the side. They gave me antidepressants. They gave me birth control pills. They gave me pain medications, and they gave me some other random medications I don't remember at this time because I didn't even take them. So I went on, and I actually found a nutritionist after going to all these different doctors. I went to Reiki healers, I went to chiropractors, I went to Eastern and Western doctors. Anyone who said that they can help me, I went. And then I found this one girl who's a nutritionist, and she was only a few years older than me. She only had graduated college, I think, that year. And she recommended that I give up gluten. So gluten, I'm like, what's gluten? Because this was 1994. And so I didn't even know what gluten was. It wasn't really talked about that much. And she's like, just remove all the bread, the pasta, she pretty much named everything I ate as an Italian girl from New York. So I'm like, well, I'll do anything. So I followed her diet, and after about 30 days, I was like, my joint pain's a little bit less. My digestion's a little bit better. So all these doctors who said there was nothing I could do to feel better were lying, because this girl who was a nutritionist, not even a doctor, gave me one thing to do that I was able to do on my own without a medication, and that helped me feel better. So I decided I was going to go back to school as a naturopathic doctor. Well, first as a regular doctor. I learned all the pharmacology and what pills went to what ills, and I wasn't really loving that. So I found out that there was a field of medicine called natural medicine, and I decided to switch to that and became a naturopathic physician. In the period of time I was doing every lab test on myself, I found out I had autoimmune Hashimoto's, which is why my hair was falling out and my joints were hurting. I had multiple chemical sensitivities. I had parasites. I had the gluten sensitivity. I had so many things wrong with me, and I kind of fixed them one by one. And I met my then husband at the time, and I said, hey, you're not going to want to marry me because I can't have kids. I am broken. I am less than a woman. He said, don't worry about it. We're just dating. It's no big deal. We went to Mexico. I got sick from the water. He said, you're pregnant. I said, you're an asshole because I can't get pregnant. Why would you say something like that? Well, anyway, we took the test, ended up having my son Paxton naturally at age 40. It was the best day of my life. I was so happy. I felt like just sending a big F you to all those doctors who told me there was nothing I could do. And, here he was, natural, no artificial anything. And it was the happiest time, but yet I went through this whole postpartum situation where my hormones just went down the tanker, which happens at the end of pregnancy. And so here I was in postpartum perimenopause. And I was feeling the feelings again, the hot flashes and the night sweats, the joint pain, the headaches, the weight gain. Holy moly, what's going on? So I'm like, I'm going to use my tools in my toolbox, and I'm going to get to the bottom of this. And today I help thousands of women every year to restore their health and feel their best in midlife. And so this is kind of my mission. It's what I do. It's what makes me happy. And so it's kind of this beautiful twist after decades of being told that I've never have children. At 40 years old, I gave birth to Paxton, and it really helps me think, no matter what you're dealing with that the doctors say, there's nothing you can do, there's no answers. Oftentimes there's answers, and you can feel a little bit better. But I had to become my own health detective. I had to really dive headfirst into natural medicine, functional medicine, nutrition, epigenetics, anti-aging, and really do anything I could that can crack the code of what was going on. Because like I said, at age 20 and then again at age 40, I was dealing with the depression, the brain fog, the vaginal dryness, all the things that women expect in their 50s. I was living at 20 and again at 40, and there was no answers. There was no textbook. There was no what to expect when you're expecting menopause. There was no birds and the bees talk. And so this here is your official what to expect when you're heading into perimenopause and menopause. This is your birds and the bees talk. This is your reverse, your puberty in reverse talk. But I'm going to kind of make this a little interactive now. So I want to know from you guys in the chat, let me know what's your number one symptom you're struggling with right now. These are just 5 of the top symptoms. There are actually 99 different symptoms of perimenopause and menopause. Things like frozen shoulder and ringing in the ears and migraine headaches and arthritis and high cholesterol. Like, these are all things that are typical symptoms of menopause and perimenopause. Let's see, we got weight gain, brain fog, low libido, amazing. Skin laxity, huge one. We lose 30% of our collagen in our skin in the first year of menopause, and then we lose like 20% each year after. So that's a big one. Yeah, a lot of people are saying all 5. Yes, the ringing in the ears, the sleep issues. So you guys are not going crazy. This is not abnormal. This is actually fairly normal for menopause, but it doesn't have to. We don't have to suffer with it. All women, 100% of women will go through menopause. It's just a fact of life. We're born with a finite number of eggs. At 5 months into our development, while we're still a fetus, we have all the eggs we're ever going to have. And then by age 30, they start to dwindle. And then by age 35, we only have about 10% left. And the quality of them starts to decline as well. And then once we don't have any more eggs left to release, we are in menopause and postmenopause. And we're not making our estrogen and progesterone the way we used to. We have about 1% of the hormones we had when we were in our prime. So all these symptoms that we're talking about, we've got osteopenia, we got vaginal atrophy, we got thin skin. It's a pretty big list here that I'm seeing in the chat. Hair shedding, weight gain, sleep, all of it. It all can be helped. And so there is an answer for you guys. But these symptoms, these are like the smoke alarm. So I like to kind of just paint a picture. So imagine it's late at night, you're tucked in bed, and finally you're just kind of drifting off, and you hear this beep, 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 the smoke alarm is going off. Your heart races, you're gonna sit up, you're gonna say, oh my God, there must be a fire somewhere, something's wrong. You call the fire department, you're smelling some smoke now, and the firefighters rush in, and you're like, okay, they're gonna put out the fire, but they just rush in and go to the smoke alarm and take the battery out. And you're like, what the hell are they doing? And they're like, we fixed it. We stopped the alarm from going off. And you're like, no, you idiot. Like, there's a fire. That's why the alarm's going off. Don't you smell the smoke? And so that is kind of what doctors are doing. When you go in and you say, I have migraines, and they give you a pain pill, instead of figuring out like why you have migraines, or you have trouble sleeping, they give you a sleeping pill. Instead of finding out why you have trouble sleeping, you're anxious, they give you an antidepressant. The list goes on and on. And so this is not normal, and it's not right. And it's just, unfortunately, that's how medicine is taking the battery out of the smoke alarm, because they're not trained to help us with the varied symptoms of perimenopause and menopause. Unfortunately, doctors like checklists, and they like to be able to say, boom, 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 this is what I match you up with. But it takes a lot more time and a lot more patience and a lot more understanding to talk to women about their hormone decline. And so that's what we do. And so, just none of these things are going to put the fire out. Taking the batteries out of the alarm, the statins, the pain pills, those are just going to treat that one symptom, and they're not even treating it. They're covering it up. It's a Band-Aid approach to medicine. And so you're still going to you cover that up, it's like whack-a-mole, and then the mole is going to come out the other side, and you cover that one up, then it comes out the other side, and these symptoms keep popping up. And so until we fix the root cause of the problem, which is the hormone decline, we're still going to have all these different symptoms. So again, silencing the symptoms does not fix the cause. If we take the battery out of the smoke alarm, the house will still burn down. And I'm here to make sure that your house does not burn down, because we only have one house, is our body. And so the problem is not the symptoms. The problem is hormone decline. And it actually begins way sooner than you think. So the average age of menopause is 51. Menopause is defined as the anniversary of 1 year since your last period. So basically, you have your last period, and if you go an entire year without having a period, that day, that's the anniversary of your last period, that's your menopause day. After that day, you're postmenopausal. Now, the average is 51, so that means 45 to 55 is about when women generally go into this menopause transition. Perimenopause is 7 to 12 years prior to that. So that means 35 years old is the average age that perimenopause starts. And you're just moving along one day, you're juggling your kids and your career and your life, and everything's fine, and all of a sudden it feels like your body betrayed you. It feels like you're living in somebody else's body. Your weight starts piling on, your pants don't fit anymore, you have mood swings, you're irritated at everybody for no reason, you're not sleepy anymore, intimacy feels like a chore, you're just like gritting your teeth just to like get through the night with your husband, and brain fog makes you question your memory. Are you having Alzheimer's? Like, what's going on? And this happens to pretty much every woman. And many women are living half their lives in this state of hormone decline. And it's not just the symptoms, it causes bone loss and brain fog and heart disease risk and low energy unless you do something about it. And it's super important that we do. Now, this is just like, again, a snapshot of symptoms. There's so many symptoms that happen with hormone decline. And some of them are like symptoms that make life annoying, right? Like, the weight gain, the bloating, the fatigue, the libido. And then there's some that are actually dangerous, like the vaginal dryness and the atrophy that can cause urinary tract infections, which can lead to sepsis, which can actually kill a woman. Osteoporosis. If we have a break in our bones after the age of 65, 30% of women will die within the year. This is very bad. Heart disease is the number one killer of women after menopause. It is a serious, serious condition. And so it's really important that we understand that there's a lot we can do about this. And it used to be that when women were in their menopause transition, they're, around 45, 50, they'd go to the doctor with many of these symptoms, and doctors would actually give them hormone replacement therapy. About 40% of women in the menopause who wanted it before the year 2002 were actually put on hormone replacement therapy, maybe some of you. And then there was a study in 2002 called the Women's Health Initiative Study, and that study caused hormone replacement therapy to be yanked from women all across the country. It scared doctors and the population away from hormone replacement therapy. And it's unfortunate because the study was poorly done, poorly put together, and was not reported correctly, and that's what caused the scare. But what did it say? Well, it said that hormones were risky, that they caused cancer, that they caused heart disease, that they were dangerous. And so these were all things that came out of the headlines in 2002. Doctors pulled prescriptions overnight. Like, millions of women flushed their prescriptions down the toilet. And just like that, hormone replacement therapy went from being standard of care to a dangerous gamble that no doctor wanted to get involved with. And here's what most people, even most doctors, don't know. The headlines did not tell the whole story. The WHI was actually a massive study. 161,000 women were recruited at 40 medical centers in the US starting in the early 1990s. And on paper, it actually didn't look as impressive as those headlines. So the truth about the study was that 70% of the participants in the study were over age 65. Now, most women who were taking hormone replacement therapy were starting hormone replacement therapy in their late 40s, early 50s. And so it wasn't really indicative of this population. Now, the reason why they did the Women's Health Initiative study was to prove that hormone replacement therapy can prevent heart disease, because they were seeing this across the board in the women that were taking it. So a lot of the people in the study who were recruited were people who they were hoping would get heart disease sooner or would show signs. And so 80% of them were obese, former smokers, already had heart disease, hypertension, or diabetes. So this is a very sick, fat, unhealthy population of women that were in this study. They also used oral synthetic hormones. They used Premarin, which is an oral estrogen that's made from conjugated equine estrogen or horse urine. So it's a horse estrogen, and Provera, which is a synthetic medroxyprogesterone acetate. So this is bad. And then the data, when they reported those headlines, they didn't even have the study data yet. They just had the one little caveat, which was a 25% relative increased risk in breast cancer in one of the groups. And so it was not reported correctly. And so here's actually what it was. So there were actually two arms of the study. One group of women had their uteruses intact, and they were given Prempro, which is the Premarin, the conjugated equine estrogen, and the medroxyprogesterone acetate, the synthetic progestin. So that group had the combo therapy. And then the other group, that group had hysterectomy, so it was believed they did not need a progestin, and they just had the conjugated equine estrogen, all oral, all synthetic hormones. So the headlines reported that there was a 25% increased risk in cancer with HRT, but it was a relative risk compared to placebo. In the placebo group, where no one was taking hormones at all, 4 in 1,000 women got cancer. In the HRT group, 5 in 1,000 women got cancer. So it was only 1 in 1,000 who got the cancer, and it was only in the group that was taking the medroxyprogesterone acetate, the synthetic progestin. The group that was taking the conjugated equine estrogen only actually had a lowered risk of breast cancer. And so all this study actually proved is that fat, sick, former smokers over 65 get more cancer than the general population. So it was a really bad study. And since then, we've had countless studies and even reviews of this particular study that proved quite the opposite about hormone replacement therapy, that shows that estrogen replacement is absolutely safe, reduces risk of breast cancer, reduces risk of heart disease, reduces risk of Alzheimer's, lengthens women's lives, improves quality of life. And so just this year, the FDA actually removed the black box warning from estrogen. So after 20 years of overstated data from WHI, the FDA revised and removed black box warnings that stated that estrogen was dangerous. Because the old labels basically said estrogen was risky and that you had to understand the risk if you were going to take it. This was on all estrogen products. And this got removed because the science is now clear. The FDA is actually admitting the Breast Cancer Association, the American Medical Association, the Menopause Society, all now agree that estrogen and hormone replacement therapy that's bioidentical and delivered in the right way and managed properly is safe for most women. And so this is a really great thing, and we don't have to worry anymore. So I'm very excited about it. I've been saying this for 10 years, but now the FDA has my back. So at least, I think what happens is, just so you guys know, in medicine, we have research and then we have what's being practiced in the doctor's office. And usually it takes about 17 to 20 years for the doctor's offices, the prime standard of care, to actually catch up to the research. And so now this is awesome because the science is clear and more doctors are starting to understand that there is really very little to no risk. So the new research says bioidentical estrogen and progesterone are safe. Estrogen replacement lowers all-cause mortality. That's just a fancy saying for dying for any reason. So it lowers your chance of dying for any reason. Delivery method does matter. So oral estrogen does come with some risks. It can affect your glucose, so your insulin resistance. It has to be metabolized by the liver, so there creates some clotting factors and some other things that might be unfavorable. So we always recommend a transdermal estrogen. And progesterone protects, progestins harm. So progesterone is what your body makes. Estradiol is what your body makes. Estriol is what your body makes. However, conjugated equine estrogen, that's what horses make. Progestin, medroxyprogesterone acetate, nobody makes that. That's what labs make. And so your body is actually very, very smart. So unlike the horse-derived estrogens and the synthetic progestins, bioidentical hormones are molecularly identical to the ones your body makes. And studies show that they actually reduce the risk of breast cancer. Estrogen replacement therapy, like I said, it lowers all-cause mortality. There was a large study published in the Journal of American Medicine, and it found that women on estrogen therapy had significantly lower rates of death from all causes compared to women who don't take it, which is huge. And this is important for bone health, brain health, heart health, all of it. And, you know, one of the big problems in the WHI was the oral estrogen, because it does have to pass through the liver, increases clotting risk. And when estrogen is delivered through the skin, what's called transdermal, that risk completely goes away. So you do not have to worry. And so this is like really, really important. And there's so many studies that back this up. So again, estrogen isn't the villain, and the actual villain, the actual thing to be afraid of, is living without hormones. Hormone decline is a thing that steals your vitality, that leads to disease, that increases inflammation, increases cholesterol, increases heart disease risk. And so I'm going to actually show you that on this slide. So really important, you know, now that we cleared up some of the fear around the hormones, I want to look at what happens if we don't replace them. So if we choose to do nothing, because we have a choice. We can replace our hormones or we can not replace our hormones, right? And it's a lot of times people think like the scary part is replacing the hormones, but actually the scary part is living without the hormones. And this is why I'm so passionate about this, because for many, many years, women were scared to do the thing that was going to help them the most. And medicine has really turn women down the wrong path where they're actually making them sicker. And menopause and perimenopause is not just about hot flashes, mood swings, and vaginal dryness. And when left unchecked, it's like pulling the foundation out of your house. And so with heart disease, before menopause, women are far less likely than men to have heart attacks. However, after menopause, that advantage disappears because estrogen protects our blood vessels, it keeps cholesterol in check, it reduces inflammation. Without it, cardiovascular disease skyrockets. And the stats are here. So before menopause, 1 in 3 women, or 1 in 7 women are at risk. And then after menopause, it's 1 in 3. And so that's a huge increase in the risk. It's more than double. Now, osteoporosis, we all know estrogen is really important for our bones because our bones are constantly breaking down and building up. The bones that you had when you were 15 are different than the bones that you have at 30. They're different than the bones you have at 45. We're constantly remodeling our bones. And when we don't have enough estrogen, we're still breaking them down, but we're not building them up as fast. So 1 in 3 women over age 60 who break a hip will die within the year. And this is crazy because it's not just weak bones, it's about quality of life, resilience. They don't die of the fracture itself, but they actually die from the complications that come with immobility. And so it's really, really just not a quality of life issue, it's a survival issue as well. Dementia and Alzheimer's, this is huge. Here's something that doctors don't mention. A huge number of Alzheimer and dementia cases in women have a hormonal component because your brain is covered with estrogen and progesterone receptors, absolutely flooded. And these hormones help your neurons, They help your memory, they help your mood, they help synapses fire, so the messages from one nerve cell to another, and they help with cognition. And so taking them away is like pulling the insulation out of the electrical wires. Sparks start flying, things go on fire. And this is why we have that menopause brain or menopause fog. It's not in your head. It's actually your brain starving without the hormones that it needs. And then mood and metabolism, another thing, really, really devastating. There is so much more incidence of first time depression, first time anxiety. Women who have never had these issues before are all of a sudden being put on SSRIs and anti-anxiety meds when they could be just put on hormones. If you already have issues with depression and anxiety, they get worse with hormone decline. So it really is a domino effect. Your metabolism, your musculoskeletal system really suffers. We start to have sarcopenia. It's harder to maintain muscle. Insulin resistance skyrockets without estrogen. UTIs happen, vision problems, macular degeneration, so many things. It's like a domino effect. And so your health, it feels like everything's working against you, but it's really just one thing, and it's your hormones. So ignoring hormone decline is not just about like just aging gracefully. You're actually accelerating aging. So it's just like if you have the engine light comes on in your car, you're not just gonna like cover it up and say, well, I'm just gonna do this naturally. You're gonna actually do something about it otherwise your engine's gonna feel, right? So this isn't just about living longer, it's about living better with more energy, more strength, more clarity, more joy. Because we all wanna live not just a long life, but a healthy life. And so the benefits of balanced hormones, I won't belabor this too much, but, clearer brain, sharper memory. A lot of women feel as though they're losing their edge as they enter perimenopause and menopause. You forget where you put your keys, you forget why you walked into a room. It really can affect our confidence and just our relationships and our ability to just feel like ourselves. And so when hormones are restored, a lot of times that brain fog lifts. And studies show that estrogen therapy protects our memory and lowers our risk of Alzheimer's quite a bit. Deep restful sleep, my goodness, if you cannot sleep, we are not happy. Progesterone is sometimes called nature's Valium because it really helps us feel balanced, it helps us sleep. Estrogen helps us stay asleep. And so just think how much happier we will be if we can have a good night's sleep. We'll have more energy, our metabolism is better, our immune system functions better, our brain functions better. We do a lot of our repair and our immune system functions while we sleep, so it's really important to have that deep restful sleep. Our energy and metabolism, our body will start working against us if we don't help it. Fat cells don't just cling to your belly. It just, a lot of times when we have low estrogen, our metabolism just declines. We have a harder time losing weight. We have a harder time just getting the energy to work out. Our muscles don't contract as well. And so super important when you have balanced hormones, it just feels like everything's normal again. A lot of times women say, I haven't changed my diet, I haven't changed my exercise, but now I have this belly fat. One of my patients told me, I feel like I'm 26 instead of 62 because I started having that spare tire around my midsection. My doctor told me there was nothing I could do about it. And now she feels like her belly's shrinking again, her workouts are more powerful, and she can keep up with her grandkids, which is awesome. Desire and intimacy. I am one who is not afraid to talk about sex. And for so many women, hormone decline, the dryness, the pain, it can just be unbearable. And you really feel like a part of you is gone, even though you love your spouse or your partner. And, when you restore estrogen or progesterone or DHEA, the spark comes back. Lubrication, sensation, our body remembers what it's capable of. And we can actually have a really active and enjoyable sex life with our partner or without our partner for that matter. And then of course, strength, protection, lowered risk of heart disease, stronger bones, better muscle. And with muscle is our metabolism. When we have more muscle, we burn more calories at rest. Studies show that when people go into the hospital for really any reason, whether it be an accident or some type of disease, those people who have a higher concentration of muscle on their body are more resilient and bounce back faster with less interventions. So that's super important. And then lowers your risk of breast cancer. Super important, because that's one of the things people worry about. And I just want to clarify that hormones themselves are amazing. Like, some people say they're magic, but they're not magic. It's just supporting our biology, and we don't want to do that in a vacuum. So we do want to make sure that we are looking at our diet, eating anti-inflammatory whole real foods, getting enough protein, getting enough fiber, getting our healthy fats. We want to make sure that we have some type of wind down routine to help us sleep at night, or getting rid of the blue light, or keeping our room cool. We are making it dark. We are not stressing out about work right before bed. This is important. Exercise, we want to make sure that we are doing some heavy weight training. We are training to be strong, not skinny. So we're not overdoing the cardio. We are not shying away from the heavy weights. We are really helping our body. Heavy weight training is the one thing that can actually improve our testosterone levels. So I'm a huge fan of weight training, pushing the failure, and minimizing the cardio, although I still do enjoy running. So, but that is important. And then stress reduction, having some type of practice to reduce our stress, saying no sometimes, letting people help us, journaling, gratitude journals, prayer, meditation, all the things that we can do that are non-productive, painting, dancing, laughing. These are important in our hormone balance. And then supplementation is the last thing. And supplementation includes hormone replacement therapy and omega-3s and vitamin D and things like that that are going to help us to thrive. So I call it DRESS for menopause success. So D is diet, R is rest, E is exercise, S is stress reduction, and S is supplementation. So those are the things that you want to do in addition to restoring your hormones. And sometimes that's like, oh my God, how many things am I going to do? It seems like a lot. But just remember that when your hormones are supported, it's a lot easier. So sometimes women have to start with the hormones just so that they could have the strength to do the other things. So hormones are preventative medicine, right? So it's not just about fixing your symptoms, it's about preventing them. So there's a study in 2008, it looked at 80,000 postmenopausal women, divided them into two groups. So you had your women who never used hormones on one side, you had your women who used synthetic progesterone or synthetic progestins, you had women who used bioidentical hormones. So these were, and so this is one of the few studies that was done on bioidentical progesterone. And what they found is that the women who never used any hormones had a higher risk of breast cancer. The women who used synthetic progestins actually increased their risk of breast cancer. But the women who used estrogen and bioidentical progesterone, they actually had no increased risk, and they had a significant reduction in breast cancer compared to the synthetic group. So this is just proving to you that not all hormones are created equal. All right, so here's my little analogy. I'm trying to make it super simple. So we're talking about hormones. We have our synthetic hormones, we have our bioidentical hormones. Bioidentical means identical to what your body is expecting, identical in chemical structure to what your body made. So we have oranges and we have orange Skittles. They both are called orange. They both have an orangish flavor and kind of an orangish smell. They're both a little bit sweet. However, the orange found in nature has vitamins, fiber, minerals, antioxidants. Your body knows exactly what to do with it when you eat it. And when you eat it, it's going to make you feel healthy. It's going to protect your immune system. It's going to do a lot of good things in your body. The Skittle, that is made in a factory, not in nature. Artificial flavors, artificial colors, dyes, sugar, high fructose corn syrup. These are things that your body does not recognize the same way It does, the orange. And if you ate them every day, you would actually be fat and sick. And so that's the difference between bioidentical hormones and synthetic hormones. Bioidentical are natural, made in nature, recognized by your body, and nourishing and supporting the systems of your body. Synthetic are artificial, confusing to your body, and harmful over time. So that is kind of like my analogy. And you would say in medicine, when I talk to doctors, they're like, oh, you prescribe hormones, hormones are bad for you. That's like saying oranges are bad for you because orange Skittles are bad for you. And that would be false. Absolutely false. So what are hormones and how do they work? This is going to be a really quick little 2-minute scenario, a little science for you. So I'm going to keep it simple. Hormones are chemical messengers. They are made in the glands of your body, your ovaries, your adrenal glands, and some in the peripheral tissues. And they travel throughout the bloodstream, delivering instructions to the different systems of your body. They're bringing the bones, the heart, the skin, the muscles, things like that. And so might be what some of the messages look like. Grow a new bone, make more collagen, remember this memory, stay calm and sleep. So these are just little messages, this is little signals, and this is the language of the hormones. Your body knows the language of the hormones know the language of the hormones. So it's just a little message that gets sent. And so when you have bioidentical hormones, it's pretty clear, nothing confusing, the body knows what to do. Synthetic hormones are a little bit glitchy. And so your body doesn't quite understand what they're trying to say. Sometimes the message might get through, but sometimes it gets a little jumbled. Sometimes it looks like hieroglyphics. And so the body is a little bit confused when it gets these messages. It's like, what does it want me to do with this? And that's kind of what the difference is. Bioidentical hormones are exact copies. They know exactly what to do, whereas the synthetic hormones, sometimes they work and sometimes they don't. So I'm going to bust some myths about hormones for you, and I'm going to answer some of your questions because I see there are quite a few of them in both YouTube, which is over here for me, and my Zoom questions, which are over here for me. So I'm just going to take one slide and answer some questions. Okay, number 1, hormones cause cancer. It's untrue. We talked about this already. Bioidentical hormones, bioidentical estrogen, and bioidentical progesterone reduce the risk of cancer. So if you've had a history of cancer, if you have a family history of cancer, you have better outcomes if you take bioidentical hormones. Now, if you have an active cancer that you're currently treating with hormone-suppressing medications, we may have to wait on the estrogen until you're off those medications. We have many women in our practice who are breast cancer survivors, uterine cancer survivors, other types of cancer, and they are doing fabulous on their hormones. So do not let any doctor tell you that you cannot take hormones if you have had cancer. You're too young if you're still cycling. You have to wait till menopause to start hormone replacement therapy. That's absolutely false as well. Perimenopause is actually the most efficient time to take hormone replacement therapy. Top things off before they decline. It's a lot easier to prevent a problem than to fix it after it's already started. But there's no too young and there's also no too old. It's not too late to take hormones if you are 60, 70, 80. Will you have gotten more benefit from your hormones if you took them immediately as you were either entering menopause or if you had a surgical menopause, like a hysterectomy? They should have hormones waiting for you as soon as you get out of surgery, because that way you don't have to live any time without your hormones. However, there's still many, many benefits to your brain, your skin, your urinary tract, your hair, your skin, your nails, your digestion, bones, so many things that can be helped no matter what age you start hormones. So you're never too young. There's women in their 20s and 30s who can benefit from hormone replacement therapy. I could have benefited when I was 20 and my ovaries had failed. There are women in their 80s and 90s who can benefit from hormone replacement therapy, and we are here for all of them. Myth, menopause is natural. You should tough it out. That's absolute bullshit. Natural does not mean suffering. It is also natural. It would have been natural for us to live out in the woods with no electricity, no eyeglasses, no purified water, no sanitation, but we're not doing that either. So if you want to drive a car and you want to have a cell phone and you want to be on Zoom and you want to do all these things, that none of that is natural. And to be honest, like, we historians and anthropologists, they kind of feel that we are living longer than we would have had we not had all these interventions, medical interventions, sanitation, industrialized farming, like all the things that help us survive. And so we used to be that women didn't live much past the age of menopause, but now we are living 30, 40 years past menopause at least. And so we do need to support our systems if we want to have the most healthy life. So again, the decline is not the danger, or the decline is the danger, not the replacement. So the declining hormones is what's causing your heart to struggle, your bones to struggle, your brain to struggle, your liver to struggle, your metabolism, your pancreas, your genital urinary tract, your hair, your skin, your nails. All these things are struggling because hormones, estrogen, progesterone, testosterone, DHEA, these all are very protective. And so things like brain fog, like, it's one of the scariest symptoms, I think, that women face is brain fog, because people joke about it and call it menobrain or mental pause. And when you're in it, that's not funny at all. Actually, walking into a room, forgetting why you're there, losing your keys, forgetting appointments, struggling to find the right words. This is very scary. One of my patients last week actually told me that she forgot the passcode to her phone one day and she needed to make a call. And she couldn't for the life of her remember that passcode, and it made her burst into tears, and she thought, is this dementia? Like, am I having dementia? And no woman should live in that fear, and no woman should have to feel that way about their body. You know, estrogen and progesterone isn't just about fertility, they're critical for brain health. Your neurons are covered in hormone receptors. And when your hormones decline, your brain is like starving for them. And studies show women who use estrogen replacement lower their risk of Alzheimer's disease, and the longer they use it, the lower their risk, which is huge. There was a study of 96 women, and they used DHEA cream for 26 weeks. They were tested on memory and verbal learning. The women who got the DHEA significantly improved all of their scores. The placebo group did not improve at all. And pregnancy even protects the brain. So they find that women who have been pregnant at least once have a lower risk of Alzheimer's, thanks to that surge in estrogen and progesterone that happened in the brain during pregnancy. So hormones are not optional for brain health. They're not just about stopping hot flashes. They're about protecting your brain, which is really important for independence. And I know that I love my independence, and I do not want to have anyone have to take care of me, wipe my butt, shower me, any of that stuff, as long as possible at least. And so, like, our brain health is like so important. Like, of course, we want our body to look a certain way and our skin to look a certain way, and we love to have all the things, but like, when we lose our brain, we lose ourselves. And so, just to recap, let's step back for a minute. So we covered a lot of science. We busted some myths. We looked at the real risk, which is actually hormone decline. And I don't want you to live in fear. I want you to actually be excited about what is possible. So, like, let's just picture this. So we have two women, both 55 years old. So here we have the first one. Let's say her name is Stacy. And Stacy wants to just do it naturally. But she's dealing with hot flashes. She's dealing with night sweats, brain fog. Her weight is creeping up. Her cholesterol is rising. Her bones are getting thinner. By 65, she's going to be on 3 to 6 medications. By 70, her family is worried about her memory. By 75, she's wondering where her vitality went. And then we have Mindy. Mindy's also the same age, but she's taking action. She's balancing her hormones, bioidentical hormones. She sleeps through the night. Her brain is sharp. Her energy is high. She loves to go to the gym and work out with her husband. She has her spark, her curves, her The libido is high, her risk of disease is low. She's living, traveling, enjoying her life, her partner, her friends. They're the same age, but they have two very different futures. We're all living half of our lives in menopause. That's 30, 40, maybe 50 years. And so we have to ask ourselves how we want to spend these years. I know that I don't want to just survive. I want to thrive, and I want that for every single one of you. And hormone balance is not just about vanity. Yes, our skin will look better. Yes, we'll be able to maintain better body composition. Yes, our hair will look better. But we also want energy, strength, clarity, passion, resilience, and I want that for every single woman out there. And I just want to play a quick little video of some of the women who we've helped.
I was feeling really, really crappy.
I had still been experiencing vaginal dryness, problems with intercourse, weight gain, hot flashes, and the moodiness.
I had total body pain, insomnia, super, super dry skin.
Would get these intense sugar cravings, especially when I would get stressed or depressed. I wanted to turn to sugar.
My periods were very irregular. I had a lot of anxiety. Oh, the insomnia was real bad. I had low tolerance for stress. I had horrible acne. My face was never clear, ever.
I was brain fogged, like I couldn't pay attention to things. I thought that there was something wrong with me.
I had horrible hot flashes, couldn't sleep, weight gain, cranky.
My first bone density was in 2018, and I have very mild osteopenia. And then I had my second in 2022, and I had moderate and severe osteoporosis. And I was absolutely floored.
I'm a breast cancer survivor, so I've been told I can't take hormones. I clicked on it and I listened to that masterclass that she does. And by the end of it, I was convinced that I needed hormones and that it would be okay, even though I was a breast cancer survivor. And I didn't understand the hormone connection because, like everybody else, I was stuck in that terrible mindset that hormones cause breast cancer.
Momentarily, I just connected, I just knew her expertise, her honesty, her compassion, everything about it, I just knew was exactly what I wanted.
I listened to the webinar, I signed up, I started my therapy. I am 6 weeks in. I walked 4 miles yesterday. I am getting back up at 5 a.m. when I have not been able to do that for months.
I have more energy. I definitely sleep better.
Do you see how beautiful my skin is? My face has never looked so good. I am elated. I feel like I'm reclaiming the youth that was stolen from me in my 20s.
I went from severe osteoporosis to very little, matching scores from 2018 and less than osteopenia.
I understand my body in a way I never would have understood before. My health is in my own hands. I decide what tests I want. I decide how to do my supplementation. I decide how to work out and when.
After the first month, I've had 0 hot flashes. I sleep through the night. I never want to stop taking them. It really has changed my life, and I recommend them to anybody and everybody.
I love this program. I love the results. I love how I feel, and I'm always sharing it with people.
I can't stress enough what a difference it has made in the short time that I've been replacing my hormones, and honestly wish I would have started much sooner had I known this was out there. So if you're on the fence, all I can say is try it. You'll see a difference.
It's definitely worth the investment because you're investing in yourself. I'm investing in myself and my future health, and to me that's more priceless than anything. And the cost is minimal compared to what the ongoing damage could result in if I didn't take care of my hormones and I didn't try to turn back the clock just a little bit. I'm really glad to be a part of it. I am just looking forward to the future.
All right. So those ladies are just a few of the thousands of women who have worked with us and used the clean hormones to really transform their body. And I feel like it's always better hearing from them than from me. I can teach you all the science, but I can't really show you what it feels like to be all these different women. And so you're probably wondering, like, now I think I've convinced you or helped you to see that hormones are not dangerous and they are a possibility. And so I'd love to share with you how you can actually balance your hormones, support your systems of your body, and do it very, very affordably, safely, and with support. So if you're ready to stop guessing and start feeling better, I do have something special that I want to share. So here is what I feel like every woman should have. Guidance from experts that understand their hormones, not once a year, 7-minute doctor visit with a prescription and no understanding of what's going on in your body. You should have a plan that's personalized to your body, not a standard dose or prescription based on your age and your height and your weight. You should actually get personalized to your symptoms and how you're feeling and what you want for yourself. And then you should get ongoing support because our bodies are constantly changing. Our hormones change, our symptoms change. We have life events, stressors, illnesses, other things that can impact our hormone balance. And you should have clean bioidentical formulas that work with your body, not against it. And so we do have something really exciting that we've never offered before. We have personalized hormone support with our Clean Hormones Complete coaching program. It's only $49.95 a month, and what you get is quite incredible for that price. So you get personalized onboarding. So we're going to have you take a detailed hormone health assessment. You're going to meet one-on-one with one of my amazing, highly trained by me hormone specialists for 30 minutes talking about exactly your state of health, what you're experiencing, and where you want to go. And they're going to build you a custom hormone support protocol based on your symptoms and goals. This is going to be very easy to follow, fit in your lifestyle, and you're going to feel supported and you're going to understand what's going on with your body, which I think is very empowering. And then you're also going to get weekly group coaching. So we have an amazing weekly coaching call where you can get on, ask questions, hear the other questions, learn more about your body, about some of the lifestyle practices. And then we have a 24/7 online community where you'll have chit chats with your other peers, share recipes, share ideas, get more support. You can connect with other women and receive more insight from our coaches. And then probably the best part of it is we have this hormone hotline where you can call in and have a private one-on-one conversation with a hormone specialist in real time, live. There's no time limits. You can call as much as you want. It's Monday through Friday, 10 a.m. to 5 p.m. And you get to actually really talk to a person. So it's not AI, it's not a chat bot. Like I see so many telemedicine companies do that. They're like, you have unlimited support and you cannot get a freaking answer. And they're recommending antidepressants instead of hormones. And I'm just like so frustrated with that. And then your doctor's office, good luck talking to a doctor. They're going to bill you and it's going to be really annoying. And then you have access to our Healthy Hormone Academy, which is like a lot of education. There are meditations in there. There are workouts in there. There are recipes, teach you how like a really simple system for exactly how to eat, move, meditate, and support your body throughout the menopause transition in addition to the hormones. So, we've got breath work, we've got pelvic floor therapy at home, we got stress reduction practices, menopause specific nutrition and workouts. It's really quite amazing. And then every 4 months, we're going to do another deep dive into your symptoms just to check in with you and see where you're at. So this is in addition to you being able to call in anytime. And then we're going to update your protocol based on your new symptoms and your new symptom and how you're feeling. And so it's basically always guided, always evolving. And so you may need no changes to your hormones. You might need a lot of changes to your hormones. And it's just, we're going to keep you progressing through your journey because our bodies keep changing. And to be honest, not all hormones are created the same, even the bioidentical ones. This is why I created Clean Hormones. It to me is a better way to balance. If you're going to put something in your body every day, you want it to be the cleanest. I'd like to just know in the chat if someone goes, if you guys are buying moisturizer or shampoo or conditioner or anything you put on your body or in your body, a lot of times you turn the package around, you look at the ingredients, and you want to make sure that there's natural ingredients in there. Well, how many times do you do that with your medications? You don't really do it. Most people don't, because it comes with this little tiny folded up piece of paper that you need like a Sherlock Holmes magnifying glass to read, and the print is like 1 point. It's so tiny, and that has all the ingredients and all the side effects in there. And most hormone products have parabens, microplastics, petrochemicals, and toxins that are actually damaging to your hormones in them. And so I worked for years to create what we call clean hormones. They're 100% vegan, gluten-free, cruelty-free certified. So Leaping Bunny, the Cruelty-Free International certified them because we do not test on animals. And then the Clean Label Project, third-party certification, they certify them toxin-free, chemical-free, and that they're pure, and they have in it what they say they have in it. We are a plastic neutral partner, so we do every purchase helps the environment. All our ingredients are ethically sourced. They're formulated by myself, a female physician, and we have them third-party tested for purity. So you actually know what you're putting in your body. This cannot be said for most hormone prescriptions. And so, or any hormones out there on the market. We are the only ones that are Clean Label Project certified and Leaping Bunny certified. And so you can be really proud of what you're doing and what you're putting in your body. And even when you support Glow Natural Wellness in any way, you are supporting the Clean Label Project and Cruelty Free International as well, which makes me feel good. You know, like I said, most hormone products are tested on animals in inhumane conditions. And if I can avoid that in any way, I'm going to. And most contain forever chemicals, microplastics, parabens, petrochemicals. These are hormone disruptors, endocrine disrupting compounds. And so your hormones that you're putting in your body to help your hormones often contain hormone disrupting compounds. Try that on for size. It's mind-blowing, but it's true and it's scary. So here is kind of the clean versus dirty hormones. I'm not going to read this whole slide, but this is on our website as well. Just what you need to know is that we're free from microplastics, not tested on animals, 100% plant-based, no prescription needed. So you can buy these right off our website, which is absolutely crazy for now, until the government takes me down. But this is what we're able to offer for now. Free from petrochemicals, free from forever chemicals. The hormones actually have actual estradiol, real progesterone, real DHEA. So there's real hormones in these that are plant-based, made from the chemical component in wild yams called diagenin. This is what's made this is the same as bioidentical prescription hormones. The difference is the additional ingredients. And so we do not have any forever chemicals, no endocrine disruptors, and they contain organic ingredients, which is very, very cool. It's something you can feel good about. I know a lot of my audience is very holistic based and tries to be as clean as possible, and this is just one additional way you can do that. A lot of times the side effects women get from hormone replacement is from the endocrine disruptors. And so again, bioidentical, toxin-free, cruelty-free, and supported by real hormone specialists is what you're going to get with this special. So the clean hormones coaching, $49.95, you get up to 3 hormones that you can pick, whether you want estrogen, progesterone, testosterone. Well, it's not testosterone, it's DHEA to support your testosterone, because testosterone is still a controlled substance. We will be offering testosterone through our telemedicine in about 2 to 3 weeks. But we have estrogen, estradiol, to progesterone, and testosterone support through DHEA. And you get 25% off with the clean hormones coaching. So to join the coaching for $49.95, you're gonna get 25% off your hormones for life, which is super cool. It brings them to about $31, which is like $1 a day for hormones. Very affordable. And so again, Clean Hormones Complete, $49.95. This is a limited offer. In fact, that we can only support so many women at one time because of the one-on-one nature of the coaching, the ability to call in and ask questions at any time. So we do have to cap it as it fills up. You're going to get your one-on-one consultation, you're going to get your personalized protocol, you're going to get your unlimited support, and you're going to get a lifetime discount of 25% off throughout your lifetime of the program of your hormones. So that is very cool. There's no commitment. You can cancel at any time. You can buy the hormones and not the coaching. You can buy the coaching and not the hormones. You can buy the coaching and one hormone. So it's very customizable to your unique situation. A lot of times in early perimenopause, you may only need progesterone, so that's all you have to pay for. So it's really up to you. If you don't know what hormones you need, join the coaching, and then you'll have your first consult, and your hormone specialist will help you figure out which hormones you need. So comparing this to what else is out there, traditional clinics that are online, they're going to charge you at least $99 per hormone. You're going to have no one-on-one support, no lifestyle coaching or guidance. So you're only going to get the hormone component. You're not going to get the diet, rest, exercise, stress reduction component, which is equally as important. There's no community. Often your communication is just a chat bot, which sucks, to be quite honest. And a lot of women who are in these programs are confused and unsupported. These are the women that corner me in the elevator all the time. They're like, oh, I'm on hormones through MIDI health or this health or that health, and they're not getting the support they need. Now, you can also go to your local doctor if they are willing to prescribe hormones. A lot of times you're going to pay out of pocket because not covered by insurance, oftentimes, unless you have severe vaginal dryness or horrible hot flashes, and then you might get it covered, but you might not get all the hormones you want. You're going to have expensive check-ins. It's going to be hard to get an answer from your doctor. You're going to have to go in, wait in line, sit in the often symptomatic waiting room where there's disease. And a lot of times you're still going to have your symptoms dismissed, and they're still going to lack answers. Unless you live next to a really cool hormone specialist, then that could be different. But with the complete hormones coaching, you're going to get personalized intake, one-on-one consultations, custom protocol, weekly group coaching, unlimited personalized one-on-one support, Healthy Hormone Academy access, updates to your protocols every 4 months or as you need them, and you're going to lock in that 25% off savings, which is absolutely amazing. So, if you're done guessing, if you're done feeling like crap, then this is it. So here's how you sign up. The link is getcleanhormones.com. I'll pop that in the chat if I can. Getcleanhormones.com. Tried to make it easy for you guys. So it'll take you right to the page that explains this offer. Don't forget when you check out to use the code COMPLETE25. So again, you're going to get the Clean Hormones Complete. It's usually $80 a month. It's $49.95. And you're going to get 25% off for life on the hormones that you choose. I'm going to try to see if I can. I'm going to go to camera, and I'm going to see if I can switch to the website. No. Okay, I think I have to minimize that or bring that over here. Okay. So you should be able to see the website now. And this is going to be where you go when you go to getcleanhormones.com. It's also on our website. So it's just going to explain what I just explained to you. It has a code here, COMPLETE25. You're going to put that at checkout. And so you're going to get your Clean Hormones coaching for $49.95 a month. And then you're going to get 25% off your hormones. So we have everything pre-selected here. You can add them to your cart. So I'm going to hit add all, and it has some more information down here, what's included, the benefits, some frequently asked questions, all that stuff here. So I'm going to go ahead and add it to the cart, and then I'll bring you to the cart just so you can see. All right, so this is my cart now. So it did add, I think I have 2 in my cart because I was playing with it earlier. So let me take that out. So it's going to add all 3 hormones to the cart. But let's say you're like, I don't think I need the testosterone right now, so I'm going to delete that. I'm just going to get the estrogen and the prodrome and the Clean Hormones Complete. Then you're going to come down here, and there should be, where's my spot for my coupon code? let me just go refresh my page. Oh, it's at the checkout. So I do a checkout. I think I had 2 in the cart. Whoops. I had 2 clean hormones complete in the cart. Let me go back to the cart. Because I was playing around with this earlier. So, all right. So I'm going to go checkout. And then you're going to come to the checkout page here. Make sure it has all my information in here. So we don't want to look at my address. But we will go complete 25. You want to make sure you put that in so you save. And you want to check this box. It's just letting you know you understand that the Clean Hormones is a monthly membership, so it's $49.95 a month. Cancel at any time. And then you're going to apply. And it brought it down to 117. So it gave me my hormones are $31.50 each. My Clean Hormone coaching is $49.95. My shipping is free. So that's pretty cool. So that's how that works. I'm going to go ahead and go back to my camera. And I'm going to go back to some questions. So let me find my Q&A. I think I lost it. So let me get back to my Q&A. I have too many screens open. Let me minimize this. Okay, I got you. That's the chat. Oh, let me minimize this. Close that. All right, let me see if I can get my Q&A back up. Yeah, there we go. I got you. Okay, so let's see. I'm going to answer some of your questions now, and feel free to stay on as long as you like. I'm going to be answering questions on both YouTube and the Zoom room. So we've got, are hormone creams more effective than an estrogen patch or a progesterone pill? I wouldn't say they're more effective or less effective. They're just a different delivery method. The patch, a lot of women find that they get irritation from the microplastics in the glue. And a lot of times it falls off if you are active and you like to work out and swim. And so, yes, it can be could be comparable to those methods. I'm in Canada. Will you ever be able to resume sending hormones? We can send estrogen and progesterone to Canada. We cannot send DHEA because Canada has made DHEA against the rules. So, but yes, we can send estrogen and progesterone to Canada. Okay, let's see. I'm 71. I have significant bone loss in the last year. How much topical estrogen is recommended to strengthen bones? It's going to be different for every woman, and so I cannot give you doses on this particular masterclass because I don't know your history, your current levels, whether you've used hormones in the past. You do not need to get a mammogram before starting estrogen replacement. How long can you remain on HRT? Most women will remain on HRT until the day they die because of how they feel and they keep getting the benefits. You do not have to stay on HRT until the day you die. You can stay on for as long as you want. It's not like a drug where you have to do we have withdrawal symptoms per se, but the fact is you can have issues with like your symptoms coming back. So if you are on hormone replacement therapy for, let's say, 10 years, and then you want to stop for some reason, eventually your vaginal dryness will come back and your bones will start to get weaker and your collagen will start to diminish again. And you'll start to see the symptoms of hormone decline again when you're not on hormones anymore, but you will still have the benefit of the time that you were on the hormone replacement. So it's really a personal decision. I'm 65 years old and have not taken hormones. Can I start now? Absolutely, yes. You can and should start now. I guess the question is, do hormones and thyroid issues connect? Where do we find a doctor who can prescribe when typical allopathic doctors won't? Right here, we can help you. Yes, there is some interconnectivity between estrogen, progesterone, and thyroid. And so sometimes you might need to monitor your thyroid hormones if you are taking like a leothyroxine or a levothyroxine, or a leothyronine or a combination. You may need more or less of your thyroid medicine when your hormones are balanced compared to when you don't have any hormones. So yes, absolutely. Dr. Michelle, I'm so glad to be attending this webinar again. Wonderful. So glad to have you. Would you be able to talk about estrogen dominance and how does it show up in blood work? Yes. So estrogen dominance it can mean a couple different things. So it can mean your body is making too much estrogen, and so the estrogen is high in relationship to your progesterone, or it could be that your body is making too little progesterone, and so estrogen is high in relation to your progesterone. And you could have normal estrogen, but still have estrogen dominance. Oftentimes, we can also see estrogen dominant symptoms from things like synthetic estrogens or estrogen mimicking compounds can give us those symptoms as well. And yes, if you have estrogen dominant symptoms, you still may need estrogen replacement as you replace your progesterone. And you may need to use a substance like DIM or something to help you detox your estrogen. So that could be very helpful. We usually do recommend Daily Glow, which is our multi-purpose multivitamin that has thyroid, adrenal, and estrogen detox support in it. So we usually recommend that alongside hormone replacement therapy, or if you have another one that you like as well. Do you need a comprehensive blood panel review before prescribing hormones? We do not need that, but we will look at it if you have it. I'm 66, lean, athletic, clean eating, amazing. Love to hear that. No health problems, just fatigue with low sex drive. So you actually do not need to take any tests in order to start hormone replacement therapy, because it's only going to increase your health, not decrease your health. Would BHRT resumed in the late 70s slow or heal Alzheimer's? So I'm not sure when you say resumed if you were already on hormone replacement therapy, stopped, and then you're going to start taking it again, or if you've been without hormones for like 20 years. So it definitely will not hurt. Depending on how long you have been without your hormones, it may not be able to heal, but it can prevent further damage, if that makes sense. Because what happens specifically with Alzheimer's, in the brain, you start to develop these things called plaques. And the plaques are like these hard, sticky areas. And so depending on how much plaque has been deposited in the brain during the time without the estrogen, it may be hard to reverse things at this point, but you can definitely prevent further damage. And then also it's going to help with the vaginal, urogenital syndrome of menopause, musculoskeletal syndrome of menopause, heart health, all the things. Let's see, I have been reassured. I just want to ask you directly about whether side effects, risks may be higher with the oral route, sublingual. She's talking about sublingual hormones compared to transdermal. No, sublingual and transdermal is actually the same. You're still bypassing the liver and going directly into the bloodstream. So we do offer two forms of hormones in our practice. So we have the hormone creams, and then we also have hormone drops. And when you're in the Clean Hormones coaching, we can recommend what is easier for you. We usually start people on the creams and then sometimes move them over to the drops, but they are both amazing. The drops can be used topically as well as sublingually. How about DHEA? DHEA is amazing. Estrogen or hormone replacement therapy or menopause hormone replacement therapy is traditionally spoken about as estrogen and progesterone, because that is what happens when your ovaries stop working. The estrogen and progesterone go down. But we do have DHEA and testosterone, which are very important hormones. And so we usually support DHEA in addition to estrogen and testosterone. Topically applied DHEA converts at about 50% to testosterone, and combined with the lifestyle, the vitamin D, the weight training, sunshine, and healthy eating, we can normally increase testosterone levels to optimal levels in women. However, some women do need additional testosterone support, and if that's what happens, then we'll cross that bridge as well. But getting the estrogen and progesterone balance first is usually super helpful for most women, because all the symptoms I talked about today are symptoms of estrogen and progesterone decline. Yeah, so one of the comments is, I don't want to fall prey to typical medical school protocols. None of us do. I think times are changing though. I just read that they're starting to do some menopause education in like 5 medical schools now, where they had none before. So hopefully we're starting to see something. Let's see, what hormone therapy protocol helps a 49-year-old perimenopausal woman with endometriosis? I do not want a hysterectomy. Doctor won't prescribe birth control pills and suggested a Mirena IUD or hysterectomy. I'm already on compounded progesterone and just started low-dose Bias cream. Okay, so that can help you. Endometriosis is an inflammation, so we need to get inflammation down. I'm glad your doctor is not prescribing birth control pills, because those might make the issue worse. In some cases, the IUD can be helpful. So I don't know your entire situation, but I think you're starting on the right track with progesterone and estrogen cream. So that can definitely be helpful. And then just make sure also lifestyle is huge. So reducing toxins in any form, eating as clean as possible, getting fresh air and exercise, making sure all your vitamin mineral status is good, your digestion is good, your microbiome is healthy. Those are all going to help you as well. Pros and cons of prescription versus compounding hormones. This is probably going to be a personal choice for you. They all have their merits. The thing that in both prescription and compounded hormones, look at the additional ingredients, because that is a differentiator for me. Personally, when I started going through perimenopause and menopause, I did not want to put things in my body that would bring me back to the state of health that I was in before. And I really had to be careful about removing toxins from all my cleaning products, from my personal care products, from all the things. And then when I started looking at hormone replacement, I saw there was a lot of toxins in those as well, plastics, microplastics, petrochemicals. And so that's why I created the Clean Hormones brand, so that we can have, toxin-free, cruelty-free hormones. Awesome. Let's see. I've never used HRT. I've always been afraid of seeing what other women have been through it. Yeah, so you're totally fine to start HRT now. I think especially, what you said about your health, I would definitely go ahead and start. To monitor BHRT levels, many women use blood labs, which are covered by insurance. Could you please share your thought on optimal ranges? I'm not going to go ahead and give lab ranges here, because we have people from different parts of the country, and lab ranges are different in different parts of the country, as are different in different countries. So that's something you can easily look up online, or I'll post a resource on my Instagram for those markers for you. Let's see. I'm just reading. This lady has a lot of diagnoses. She used pellets, and that caused some hair loss and a large clitoris. Guy said last week, do not use online hormones. So whoever gave you the pellet should probably not be practicing. So pellets are horrible. They give you a super high dose of hormones, and you can't do anything to adjust your dose if you have negative symptoms, which it sounds like you're having negative symptoms, which are not that easy to reverse. So you would have been much better off with estrogen and progesterone in a method that you can easily adjust the dose. The creams and the drops are so easy to adjust the dose, and hopefully that will wear off after a while, because you can't take the pellet out. And so it's really sad. Yes, definitely osteoporosis, osteopenia, hypothyroidism. I would definitely go ahead and start some estrogen and progesterone if I were you. We can do a lot of good for you, for sure. And then also, we also offer a product called Glow Below, and that comes in a vaginal estrogen and a vaginal DHEA. And so it's estradiol and estriol, which is very hydrating, and that can really help with any vaginal atrophy, urinary tract infections. In fact, vaginal estrogen is a better way to treat urinary tract infections than antibiotics. And so you go to a doctor with these urinary tract infections, they give you antibiotic, and you keep getting them. If they would just give vaginal estrogen, that would be so much better. Let's see, another one, pellets, under one doctor, no complications. And then I'm seeing a new doctor. I'm coming back with high levels. I'm spacing time between injections. I am not a fan of pellets at all. I think they're a horrible way to do hormone replacement therapy. I do understand that they're convenient, but most doctors who do pellets have zero education on hormones. They are just, they get like a weekend training on how to insert a pellet, and that's all. And so I don't really think it's a very good method of hormone replacement therapy. And as does 99% of the menopause literate doctors in the country. I was just at an event with the top doctor in the UK, Oprah, and the Obama's doctor, and the top doctor in the US when it comes to menopause, and we all agreed none of us like pellets. So yeah, so that's, if that means anything to you guys. Let's see. Is it recommended that we have all three hormones, even if our testing says we only need one or two? No, you don't need to have all three hormones. I would definitely get estrogen and progesterone because those should be balanced, and pretty much every woman will need those. It's just a dosing, so you might just need a little bit of estrogen or just a little bit of progesterone. And then most women will eventually need a DHEA or testosterone added in, but personally, I like just starting with the estrogen and progesterone and then adding in the DHEA later. Unless you know for certain that you need that DHEA and you want all three right away. Yes. Yes, so there is both hormone testing that you can do and symptom analysis. Now, symptom analysis always trumps it because, especially in perimenopause, but also sometimes in menopause, the test can be a little wonky. In perimenopause, you can have hormones of a pregnant woman one day, and then the next week you have hardly any hormones. It really is like a wild roller coaster. So the test can sometimes leave you feeling confused, and so that's why over the past couple of years, we've switched to symptom analysis as the primary way of understanding the hormones. Now, if with symptom analysis we're just not sure, or you just don't have any symptoms, or you just don't know, we can do testing as well. So we do offer that. And that would be, yes, available off our website. We have many different ways to test your hormones. We have blood tests, saliva tests, we have urine tests. So there's many different opportunities, but we actually don't need the test to balance your hormones. We listen to women, what they're saying, and we trust and believe them, and then we help them with those symptoms. There's so many symptoms, it's so easy to know what's wrong based on your symptoms. Can we pay for this program with the HSA card? Yes, HSA, FSA, everything on our website is eligible for HSA and FSA. So you can just select, I think it's TrueMed at checkout, which is our HSA, FSA partner, and then you just enter in your information. There'll be a quick little questionnaire. Just say you have some symptoms. Doesn't matter which ones you say you have. Just say you have them, and it will be covered. Because menopause is not covered by insurance, but symptoms are. Crazy enough. How does your team determine hormone levels needed? Based on the conversation that you have with them. So based on your symptoms and your severity of your symptoms, how long they've been going on, and your preferences. So that's how we will be able to determine. Yeah, so we do not need a lab test to determine the hormones in your body. We just need to know what your symptoms are. If you're having night sweats and hot flashes and difficulty concentrating and belly fat gain, you're going to need estrogen. If you're having anxiety, difficulty sleeping, you're going to need progesterone. So we're going to know based on your symptoms exactly what's going on. The assessment is a very deep dive into all of your hormone symptoms, your health history, what you're currently taking, your lifestyle. Absolutely. And if you do have a recent hormone test, you can definitely submit that, and that's something we can go over while you're on your consultation. If you don't know what hormones you need, just go ahead and remove the hormones from your cart, but sign up for the Clean Hormones Complete Coaching, and you'll meet with your hormone specialist, and they will show you what you need. Absolutely. Yes, let me go ahead and share my screen again. So let's do this, and yeah, that's it. Okay, so yeah, so that is the link. Getcleanhormones.com. You will just be able to purchase the Clean Hormones Complete program if you're just not sure what you need, or if you want to just get progesterone, because pretty much everyone's going to need progesterone, and then your hormone specialist will adjust. Absolutely. And the discount code is complete25. Let's see. How we do labs, we'll ship a test kit to you or a requisition order if you're going for a blood draw. And then, you'll either take your sample if you're doing saliva, urine, stool, or a blood spot, ship it back, or you'll go to the local lab, they'll draw your blood, and the lab will give us the results. So that's how we do testing with a virtual practice. What format is the $31 hormones? It's a cream or drops. And so the drops are sublingual or topical, and the cream is topical or transdermal. I do not like testosterone pellets. I just think it's usually such a high dose of testosterone that floods your body, and then it goes away, and you're left with hardly any testosterone before your next pellet injection. And you cannot change the dose. You cannot alter it. Is hormone replacement, even this beautiful natural way, cheating what nature intended? It depends on your thoughts. So I would think I wear contacts because my vision is not so great. So is that cheating what nature intended? Should I just walk around bumping into walls? It's really something to contemplate. Like, do we use anything that wasn't here in nature before? I'm sitting at this desk in a climate controlled room with artificial light, using EMF waves to transfer my voice and my picture over the internet, which none of this is natural, but it's an improvement in my quality of life. And I think we were meant to thrive, not to hurt and not to live. And if you don't take hormone replacement, you're gonna end up being on some other drug to keep you alive. And so you might as well, is what I say. But it's up to you, it's personal choice. So you can definitely just use the lifestyle if that's all you want to do. But hopefully I've made it clear that the danger is in the not replacing the hormones. Let's see, I had endometrial cancer, estrogen sensitive, internal radiotherapy, undiagnosed endometriosis, but it was likely what I had. My GP advised that I shouldn't take HRT. Probably because that is the old thinking. And so, yes, anyone with a history of cancer is thought that they should not take HRT, but the new research is showing that it actually will increase your quality of life, prevent your risk of heart disease, Alzheimer's, dementia, osteoporosis, and dying for any reason. So yes, I think that you should take HRT. I think it would be helpful for you. Okay, I'm right there. All right, let's see. how many days a month do you take estrogen and progesterone? Most women will take it every day. Some women will skip a few days. If you are in early perimenopause and you're still getting a regular cycle, you might take your progesterone just in the second half of the cycle, but it's 100% safe to take it every day. I'm already in your program. I haven't found the weekly meeting group. You could just email support@gonaturalwellness.com. If you're in the Clean Hormones Complete Coaching, you should have the link. All right, I'm gonna go over to YouTube. Do you do saliva testing? We do saliva testing, blood testing, urine testing, stool testing, and hair testing in our practice. So we offer all of that. You can go to glownaturalwellness.com, go to the shop and see all the testing that we offer under lab testing. The YouTube chat. Yes, let me put a link in there. Look at that. Get clean hormones.com. Okay, there we go. And the code is complete 25 for 25% off. Let's see. I was a client of yours, but unfortunately switched somewhere else. I would like to come back to you. We would love to have you back. We always welcome people back with open arms. In fact, the studies show that women on hormone replacement therapy usually quit within the first year, but then want to come back. And so I know sometimes the grass is greener on the other side, but we always welcome everyone back because we love having you. And so yes, please come back. And we will welcome you with open arms. We'll onboard you fairly easily because you're already familiar with our programs. We have changed a lot and updated a lot and added so many more benefits. So I think you'll really, really like it. How do you determine how much of and which hormones are needed? We do that through conversation about your symptoms. A lot of times we'll start with a lower dose and we'll titrate up so that we get you just what you need and not too much. It's much easier to add hormones than it is to take them away. And so over the course of the first 4 to 6 weeks, we'll kind of be adjusting dosing to get you exactly to where you need to be. Can I use estrogen if I have high coronary calcium score? Gyno says risky. Gyno doesn't know about hormones. Unfortunately, just because someone is a gynecologist or a women's health doctor does not mean that they have any understanding of hormone replacement therapy. Hopefully you've watched some of the training where I talked about the protection of the heart, the myocardium, the blood vessels, how important hormones and estrogen specifically is to protect your heart. So absolutely, yes, you should be taking estrogen. You should not be without it. I use Glow Below and ProDrops. Absolutely, Liz, that is amazing. Can hormone replacement therapy help gluteal tendinopathy? It is, estrogen is very anti-inflammatory, so any inflammation or irritation can be improved. Systemic inflammation is something that happens as we lose our estrogen, and it's like a fire is going on everywhere and your body doesn't know what to do. And so when we replace our estrogen, that calms it down, and so that can definitely be helpful. Long bleeding is a symptom of what? So if you are having longer periods than you used to have, if that's the question, that is pretty normal in perimenopause for your periods to change. So some women will get super long periods, some women will get 2 periods in a month and then skip 2 months and then get a period, and some women's periods will get lighter and then heavier. And so it is completely normal to have wildly erratic periods when you're going through perimenopause. Your body is just trying to like spit out hormones, and you have this like your hormone, your luteinizing hormone and your follicle stimulating hormone that are telling your body to make more estrogen and progesterone, but it's not there, so it's shouting louder, and sometimes the message gets delayed. Okay, awesome. All right, so I think I got through the YouTube questions. What about taking herbs? Herbs are great, but they're not going to replace your estrogen, progesterone, testosterone. So herbs can be supportive for the symptoms, kind of help lighten some symptoms, but they're not going to systemically give you that protection and resilience that we need in perimenopause and menopause. What is the website URL? It's getcleanhormones.com. He said your screen is blurry. Okay, well, hopefully it's clear for most people. Getcleanhormones.com. We'll also send an email with the replay of this training so you guys can go back through it again, and the links that you can click on, likely tomorrow at some point. Tomorrow's Monday, right? Yes. How do you know whether it is that how do you know whether I need if I don't have a consultation first? Yeah, so you can grab the hormones if they're incorrect or there's something you don't need. We could refund it or we could swap it out. So don't worry. Or if you're worried about just not knowing, just sign up for the Clean Hormones Complete. You can take the hormones out of the cart for now. And then when your hormone specialist meets with you, they'll give you the code again for the 25% off. So hopefully that's helpful. Why is the purchase of DHEA regulated in Canada when it's so important to supplement with? That is a wonderful question. And we would really like to know the answer to that question. Especially in the US, like it's sold in like health food stores. So why they chose DHEA as a thing to regulate in Canada is really beyond me. Probably because it works. And Health Canada, for some reason, just wants you to be on their prescriptions. You know what? Honestly, it's probably because they prescribe it in Canada. And so they don't want people flying under the radar and not going through Health Canada. I guarantee you that's what it is. It's a money thing. Anytime there is something that can make the government money, they don't want anyone else taking away from that ability. And unfortunately, that's sad. Let's see. I will be posting the replay. It will be live on YouTube shortly after this is over, but I'm going to send the replay via email tomorrow to everyone who signed up for this webinar. So you will get an email reminder with the offer, with a recap, and with the replay. Let's see. I was receiving my first order of drops. Came on call just to ask how to use them. Well, there should be instructions with the drops, actually, how to use them. Just start with 3 to 5 drops and then see how that does for your symptoms after a week, and then increase the drops. Just titrate up as you go. Just read the little insert that came with the drops, and that should really help guide you. You can use them topically on your skin, so you can rub them in like this or into your inner thighs or any of the thin areas of skin that don't have hair, or you can do them sublingually under your tongue. Which cream do you recommend for thin skin? I cut my skin so thin, so definitely estrogen. Estrogen will definitely help thicken the skin. Do hormones protect the whole body like the patch does? Absolutely. Yeah, so the patch is just one delivery method. The transdermal hormones are the same. Is it all the hormone preparations on your website if we join the Clean Hormone Club? Yeah, so you can do the creams or the drops. Just to make it less confusing, we only put the creams on the page so that it's easier for people to just have one choice. But we can definitely do the drops as well. We can swap those out for you. Let's see. When monitoring and adjusting doses, do we need to test levels, or is it adequate to go by symptoms? Is there a risk that hormones are over-replaced? So the thing about hormones is they're like Goldilocks. And you remember Goldilocks and the Three Bears, right? Too little, too much, just right. And so when we start your hormones, we start you on a modest dose, and then we titrate up. If we go too far, you take too many hormones, you're going to have more symptoms, or you're going to have symptoms of too much. So then we'll know to back down. And so that's why your body is so smart at telling us that we actually do not need the test. But if you want to test, we do offer testing. Yes. Would I need to join this now, or just take the suggestions from the Dutch test and revisit this later? I'm not sure what the suggestions from the Dutch test are. But if you are feeling any of the symptoms that we talked about on this webinar, then I would recommend hormone replacement therapy. You guys are so welcome. I see a lot of thank yous, so you guys are very welcome. Can men take DHEA and the testosterone you offer soon? Yes, actually, yes. So men can take DHEA, and we will be offering testosterone injections very soon on our website, and that will be men and women for sure. Let's see. Ever since chemo after breast cancer, I have death with hot flashes, and now at 75 post breast cancer, again, still hot flashing. So you can definitely start taking some low dose hormones, and that would probably help you. Chemo is definitely going to cause the hot flashes for sure. So yes. Does HRT interfere with taking Fosamax for bones? I would definitely go with HRT over Fosamax for bones, because Fosamax will make your bones more brittle. If you look at the product insert, one of the side effects is fracture. So go figure. What training do the people on the calls have? They are highly skilled. They've been training for years with me on hormone replacement therapy. So most of them are nurses. Some of them are health coaches with an emphasis in female health and hormones. So they are more knowledgeable than 99% of the doctors on the planet. Very, very good hands, and they always consult with me if there's ever a question that stumps them. So yeah, it's a great team. I trust them with my mother-in-law, and I like her. I realized when I said mother-in-law, some people don't like their mother-in-laws, but I love my mother-in-law. So yeah, I trust them with her. Let's see, I want Clean Hormones Complete, but it isn't accepting the coupon. I don't want to get the hormones yet. So the 25% is only on the hormones. So the Clean Hormone Complete is already discounted. So it's $70.99 normally, it's down to $49.95. So you don't need the coupon code for that. So hopefully that's helpful. Yeah, the coupon code is only for the 25% off the hormones. My gynecologist recommends vaginal estrogen. I see they have colloidal silicone dioxide, cornstarch, hypermellose, lactose monohydrate, magnesium stearate, and polyethylene. Ooh. You may want to try Glow Below, because that is 100% natural and doesn't contain any of those things. It's not horrible, but the magnesium stearate and the polyethylene, that's like a plastic. So check out Glow Below on our website under vaginal health. All right, I got all the questions, I think. All right, let's see. Is there coconut in your hormones? There is coconut oil in our hormones, in our hormone creams. Yes. Would you be able to make them without coconut? We will in a couple weeks once our telemedicine launches. So that is something definitely stay tuned for. All right, you guys. I think I made it to the end. So I'm going to get a camera. Thank you so much for being here. If you have any questions, please email support@glownaturalwellness.com. We will be sending a replay out shortly after, tomorrow at some point, probably in the middle of the day tomorrow, you will get a replay for everyone who's signed up for this class. Also on my YouTube channel, Fix Hormones with Dr. Michelle, the replay should be available later tonight, the YouTube version. And then with our email that we send out, we'll send out all the details of the program. If anyone has any questions, concerns, definitely just sign up for the Clean Hormones Complete, $49.95. If you're confused about which hormones, we will guide you through that. That's part of the program. It's what we do. And I hope that you guys sign up soon, and then we'll see you on the call next week, which will be so exciting and so much fun. And if you have any other questions, feel free to reach out to me personally on Instagram. I'm at Dr. Michelle Sands, so Dr. Michelle Sands. I answer all my Instagrams. And I'm so happy that you guys are here. And if you have anything you need, If you like these types of classes, I can do more of them. I really enjoy teaching about hormones and hormone replacement therapy. So again, support at glownaturalwellness.com if you need anything. Getcleanhormones.com to take advantage of the Clean Hormones Complete coaching, and then Complete 25 to get 25% off your hormones. Again, I'm not sure how long we'll have this special going. We do have a limited amount of spaces in the Clean Hormones Complete coaching because we give so much one-on-one support. You are so welcome. Thank you so much. Wild Yam Cream does not do anything because wild yam itself does not change your hormones. Hormones are derived from a chemical component inside wild yam, and that needs to be the carbons and the hydrogens need to come off of it first so that it has the correct chemical structure, and then you can take it into your body and your body recognizes it as hormones. That transition cannot happen inside the body. So hopefully that makes sense. All right, you guys. Oh, Lisa, welcome. I will see you next week on the call. Thanks for signing up. And I love you guys. Talk to you soon. Have a great night. And if you need anything at all, support at glownaturalwellness.com, at Dr. Michelle Sands on Instagram. And I will talk to you soon. Bye.